everyone, and welcome to yet another episode of Diabetes Dialogues, which is our interview series here at Blue Circle Diabetes Foundation. My name is Nupur, and with me today is my co-host Snehal and our guest, Dr. Chandrakant Lahariya, who's a doctor, epidemiologist, vaccinologist, public health and policy expert. He's a writer as well, and he is the National Professional Officer at the WHO Country Office for India. Dr. Lahariya's work centers around health systems, public policy, addressing health inequities, and to develop innovative models for health service delivery. So, very warm welcome to you, Dr. Lahariya. It's wonderful to have you here today.
Thank you very much for kind invitation. It's my pleasure to be with you and the audience. We are going to talk to or interact.
Thank you, Doctor.
Welcome, Doctor.
We will be talking to Doctor today about COVID, diabetes, vaccinations, and all the queries that we've received from all of you over the past several weeks. So I'm going to hand it over to Snehal next, and she'll start with the first question.
So, Nupur gave us a very good introduction of what Dr. Lahariya does. And for our audience here who may not be aware of what the term epidemiologist means, so would you just like to explain what it means, and in case what is the profile of an epidemiologist?
Thank you. So, in this pandemic, epidemiology or epidemiologist has become a most sought after expertise.
Right.
If somebody asks me what epidemiologist does or who an epidemiologist is, I simply remind them about the detectives. The way there are detectives in movies which goes after a particular crime. The epidemiologists are disease detectives. They are detectives to find diseases. They find out what, where, why a disease is taking place. So they look after the agent who is causing the disease. They look after the host, who are the people who are getting affected. And they look after environment or setting where the disease happens. One of the easiest approach I often use is that some of you might have seen the movie Contagion. It's a 2011 movie,
Yes.
which is based upon a hypothetical scenario, but more related to SARS outbreak in 2002 and 2004. And in this movie, if you can recall, Marion Cotillard and Kate Winslet play the role of epidemiologists. They go to the situation where the disease was happening, and then they start searching that where it originated, what happens, and they try to find out solutions. One of the key roles of epidemiologists, if I would say, that they work in the setting where there is limited information available. They try to find the additional information and provide the solution based on that approach. And one of the interesting things about epidemiologists is that if they succeed in the role which is assigned to them, whatever their role they do, then they are not needed. So like a good detective, if they succeed in identifying the problem, they would not be required. They have to go for another area where the crime is happening. And similarly true for epidemiologists. So epidemiologists looks after a disease which has just started, who are getting affected. They are disease detectives.
Wonderful description, and I think everyone who is listening to this would definitely understand it now.
Thank you.
Absolutely. I really, so much more easier to understand as a layperson rather than Googling it. I will never forget this disease detective, this term.
Yeah, like I can add one more thing. So unlike other expertise, the epidemiologist or epidemiology is one of the skills. And they are medical doctors who are trained in epidemiology, but they can be from social science. There are specialized courses which are conducted for becoming epidemiologists. The United States Center for Disease Control conducts some courses, even within India, the Epidemic Intelligence Services. So you see the word and intelligence being used, like you need to find out something. So one can become an epidemiologist even without having a medical degree. So there are epidemiologists with medical degree. So it's a skill which is acquired. You need to have a graduate degree, and then you can go for a specialized course and you can be a trained epidemiologist.
I will jump into the next question, Doctor. As we complete a year of the COVID, more than a year of the COVID pandemic, what are your, brief reflections on how things have been?
So yeah, this last 1 year of the pandemic had been challenging, and that's why people fear pandemics because these are unprecedented times. Such kind of situation arise once in a century. Though we or the world had seen one pandemic in 2009 and 10, swine flu H1N1, but that did not unfold that large and it suddenly disappeared. So one of the biggest pandemic world knows and often compared with COVID-19 is 1918-1920 pandemic, and there are many learnings from that. Even in this pandemic, there would be many learnings, but we should not consider, and we know that we should not consider that this pandemic is over and anytime now. It completes its own course. What we have learned in last 1 year is that many learnings, but key that we have learned the limitations of advancement in medical care. In a sense, the world was thinking that in the last 50, 70, or 100 years, the medical care has advanced, that we can fight anything. But the way we are struggling with the healthcare services, we are not able to find a solution to a individual enemy, a virus. So that's a limitation of advanced medical care has been recognized. To me, and I work in health system, other big challenge has been recognized that how fragile the health systems we have across Indian states. And we have learned that we need to invest in these health systems over a period of time to fight a disease which might come anytime. Here, I also want to reflect that epidemics and pandemics and outbreaks are realities of time. This is not the first pandemic. This is not going to be the last pandemic. So we need to keep investing in our health systems now onward and for longer period in the future. And that's how we will be better prepared for the future. So that's the second learning. Another relevant and important learning is that we have recognized in this pandemic that how useful or relevant this is to stay healthy and fit. We know that COVID-19 disease or the SARS-CoV-2 virus which caused this disease is more severe and harsh on the people who have a comorbidity such as diabetes and hypertension. So I often say this thing that there had never been a time and incentive, more incentive than today to stay healthy and fit. So that's what we have learned, that there is always advantage in staying healthy and fit and taking care of your health condition. But this virus had taught us once again. What we have also learned that we should not be complacent. We had seen in the first wave that virus disappeared for a while and we become complacent, and then we are in a situation that this second wave is far worse than the previous one. We have learned that we need to be prepared for any future eventuality in health disasters such as this. Pandemic has also taught us that how our future fate is linked to the climate change, which result in the increased temperature and the new viruses and pathogen can emerge. It also shows that if we start destroying and encroaching in the forest and environment, and this virus has actually come from bats to the intermediate host of pangolin. So the virus has reminded and taught us that we should live in harmony with the climate, environment, forest. It's an interaction which we should balance. Of course, last 2 points that we have learned that investing in health services is the best long-term investment in the society. The cost which we are paying in terms of mental, social, emotional, economic, other aspect in this pandemic, the suffering which we are seeing, which none of us will forget, unfortunately, could have been avoided if we had a better investment in healthcare services. So there are many learnings, and in my book, which we will talk later on, we have argued that we will win against this pandemic, but this victory will not be complete till we utilize the learnings from this book, learnings from this pandemic, to strengthen healthcare system, to invest in healthcare system. So quite a few learnings, and we will keep learning. And we should use those learning for strengthening health services in India.
Absolutely agree with whatever doctor said, like a perfect learning in terms of not just what a particular country is going through, but even internationally as a whole planet, like climate changes and how different people, like we talked about fitness and everything. So it's amalgamation of everything that affects people and how we are affected by the pandemic. So my next question to you, doctor, is that as we enter lockdown 2.0, especially in India, so how efficient do you feel is lockdown and night curfews are? Like, what are your thoughts on it?
So we know that the lockdown one was implemented with a two specific purpose. And the nationwide lockdown was intended to strengthen health systems across the country because at that time the virus was new. There were limited understanding, and we need to prepare health systems. The second purpose was that the COVID appropriate behaviors of face mask, hand washing, and physical distancing were completely new, and people needed some time to become accustomed to these behaviors. In that sense, if we examine a year later, a lot of things have changed. Like, of course, people know that what will prevent them from the disease. So, if they have not changed their behavior in 1 year, it's unlikely to happen over the weekend and other aspects. Second part, health system strengthening, in my opinion, has not happened to the extent it should have happened. What was achieved that there are more supplies of masks, personal protective equipments, testing services, which are essential and required to fight the pandemic, but they are not health system strengthening. Health system strengthening would be increasing investment in health services, filling the vacancy. So something has been done, but health system strengthening has not been done to the extent it could have been done. Having said that, my argument is that if all these things could not be achieved in 1 year, then it cannot be achieved by a weekend lockdown or 2 weeks lockdown. They are not very useful. In fact, we should know why weekend lockdown or night curfew started. And they culturally that approach is not useful in India. Like the concept of night curfew came from rather first time on 14th October 2020, the government of France in Paris started night curfew. We know the culture in European setting is very different. In the day, people work hard. In the night, they come out, go to party, bar, and other things. So they have a night life, and there are more people on the streets in the night than in the day. So that's why in France, Paris, they've imposed night curfew, and that worked in their setting well. Similarly, the weekend curfew concept started because, again, in European settings, people have a lifestyle that over the weekend they go to beaches, they fly to a nearby country. So there is a more crowd on the weekend at the public places than weekdays. Now in India, we don't do that. In the night, people are at the home mostly. Similarly, on the weekend, like we prefer to stay at home, like Sunday घर पे रहेंगे type का. So all those approaches are not very useful. And that way, if we put a night curfew, it will not be helpful. But people say that, okay, fine, it reminds people that we are not in the normal time. So it's not useful, not harmful either. As far as weekend curfews are concerned, weekend curfew 2 days, in my opinion, they could be harmful. The reason is that if some I have a work to finish on Saturday, and if there is a curfew on Saturday, then I'll delay it for Sunday or Monday, and then Monday there will be more rush. So these are not useful, all such approaches. But having said all of these parts, the truth is that the kind of situation we are where our health systems are overburdened, then purpose becomes completely different. We need to have a measures because when people health services are crumbling, there is a lot of infection going around. Then we don't look around and this thing. We need to put this kind of measures, and that's what governments have done. That these are not the normal times. If you are not following COVID appropriate behavior, stay inside. So not useful, but we are in a setting in most of the places where we need to follow these approaches. And that's what people should remember, that if we do not follow COVID appropriate behavior, we will be in the vicious cycle of lockdowns, curfews, which will not be helpful, and we will not achieve anything unless specific measures are done.
Amazing point there, doctor, because I mean, I never knew about this concept of, the night or the weekend curfew and the logic behind it. And I'm pretty sure that many people, all of our friends who are watching, most of them also might not know it. So it's really eye-opening, and as we can see, it's more of a reactionary measure, the whole lockdowns. So, doctor, my next question is, now as the vaccination programs are unrolling across the world in all countries, including here in India, people have been asking us a lot of questions. For example, what is the efficiency of the vaccine? Is there a specific vaccine that we should prefer to take? Or is there any kind of a priority for people with comorbidities or NCDs? So we would request your thoughts on this as well.
So my short answer is that get the vaccine which is available immediately. Before that vaccine, after a particular regulatory process where they see the vaccine, say two vaccines are licensed, Covishield, which is manufactured by Serum Institute of India, and it's an Oxford AstraZeneca vaccine, as it is known in other countries. University of Oxford worked on this. This vaccine is on new platform, viral vector platform. On this platform, no vaccine has been made in the past. Now, efficacy of this vaccine in some trials was found that if given at the gap of 4 weeks, it is around 55%. And as you increase the gap between the two doses, the efficacy can go on till around 80%. And so if you give vaccine at the gap of 12 weeks or longer, efficacy would be 80%. Now, UK is using at the 12 weeks 80% efficacy. In India, initially the vaccine was offered at 4 weeks of gap, but now it's recommended 6 to 8 weeks of gap. We are not waiting for 12 weeks because some reason, like one reason is that in India, people already delay. If you tell people 12 weeks and they would not come, like unlike UK, you get a reminder and people follow this thing. So in India, the initial idea was to get the vaccination as early as possible. The idea is that if you give it 8 weeks, it will provide 60 to 65 to 70% protection rather than delaying it longer. But it is possible that it might be delayed further as a policy decision. So summary point is here is that this vaccine is given currently recommended at 6 to 8 weeks gap, which will provide 70% of protection as per the original trial. However, later on another trial from United States emerged, which said that even at the gap of 4 weeks, the same vaccine in US, Brazil, and one more country, Peru and Chile, it was found 76% efficacy at 4 weeks of gap. So various trials put together, we can say that this vaccine is efficacious in the range of 55 to 80%. So that's the Oxford AstraZeneca and Indian Covishield vaccine. The second vaccine is Covaxin, which is Bharat Biotech vaccine developed in collaboration with Serum Institute of India. It is developed on the platform inactivated viral vector, which means a kill virus. This platform used traditionally for developing vaccine. The trial result of this vaccine have become available. It results in 78% efficacy. Both vaccines have a comparative safety profile, which means there is not much difference in side effects. Most of them are minor. Key is, and that's what is we are hearing till now. If you take Covishield vaccine, the adverse effect or side effects like which are local injection site pain or fever or lethargy, which means person feel tired and other, are relatively higher on the first shot. So with Covishield, if you take Covishield, you will have a more side effect on the first shot. But if you take Covaxin, these are more common on the second shot. So that is the only difference. Other difference is that there are reports of some blood clot formation after the Covishield vaccine. Now, these have been investigated in detail. There is no conclusive evidence because without going into detail, I would say that these blood clot events happen in a population at a particular rate, 1 in 1,000 population per year. And so we don't know, there is not enough record of a baseline these events. So these have been found. There were 37 events of blood clot formation after 20 million doses in Europe. If we examine that, or if we assess that population over a period of time, there would be, even without vaccine, a number of blood clot events, but it appears that there is a slightly higher risk. It's called plausible. There is a, it's not say possible. It means that there is scientifically it appears that it could be possible, plausible with the vaccine, but experts have concluded that the risk of developing or individual having blood clot is far lower than if you do not get vaccinated, and then if you develop disease. In that case, blood clot formation is one of the commonest complications in COVID-19. So the benefit of vaccination outweigh the risk. So both vaccine are safe. There is a theoretical risk. Person should be aware. If you can identify and like those symptoms can be identified, and there is it's not like a life-threatening condition. The person can be given some medication and can be treated. In India, no such event has been reported, but one need to know about these things. So these are the two vaccines. The other key difference is that with Covaxin, you get 2 shots at 4 weeks gap. You are protected after another 2 weeks, so at a 6 week gap. Covishield, it's given at the, I would suggest take at the 8 weeks gap, and then you are protected another 2 weeks after second dose, and then you are protected. Now, one more point I want to highlight, that all of these vaccines do not protect from infection. What it means, that person can still be get in COVID-19 infection even after vaccination, and and that person can also transfer the infection to other family members. And that is the reason it is recommended that even if you have taken vaccine, keep wearing face mask at public place, follow all COVID appropriate behavior, because you can still be infected, or you can pass on the infection to others who are not protected or who are not vaccinated. But the key is once you are vaccinated, the person is unlikely to develop a severe form of disease, which means you might have a mild disease. There are not reports, there are not any reports of that a person vaccinated. There are reports that people got infected, some mild disease, but there are not that kind of reports that any death. There is no report of death after a person received vaccination fully protected. There are no reports of hospitalization after that. So the vaccines prevent from severe form of disease and hospitalization, both vaccines, and not from the infection. That's why you need to keep following the COVID appropriate behavior. And this is the final point I want to make, is regarding third vaccine which has been licensed in India, that is Sputnik V. This is a Russian vaccine. The efficacy of this vaccine is higher than other two vaccines which are licensed in India. It's around 92% efficacy. This vaccine, we don't know how the supply will start, but some doses will be available. The cost in the market currently being said that it will be around $10, which means around 750 rupees per shot for vaccines, and then there would be some cost. So third vaccine would be available, but not before end of May and early June. And there could be some other vaccines. So there are, okay, let me share out briefly. Moderna, Pfizer, BioNTech, which are vaccines based upon another platform, mRNA. They might be available in India because Indian government has approved their licensing for the country. There are a few other vaccines. Johnson & Johnson has developed a vaccine which will be a single dose vaccine. That vaccine is also viral vector. Some early indication of blood clot formation has also been associated with that, but with similar kind of benefit, limited risk. One of the advantage of Johnson & Johnson vaccine would be such single shot vaccine. I think that's a broad overview. I can keep going on and talk about it.
I think that was a wonderful explanation given, because I don't think so. Even if I have to talk on behalf of Nupur, I think we were not aware of so much specifics in terms of what vaccines are available and how each vaccine is different from each other. So thank you, doctor, for like explaining it in so detail. Just to reiterate what doctor said, that you can still be infected, but like he said that your COVID infection may not be as severe, or you may not require hospitalization, reduce the chances of transferring it to other people. So definitely vaccination is a must. And like he said, his short answer was get the vaccination whichever is available to you immediately. And I think the description that he gave was perfect. So you can uh, decide the time duration between your two doses and take the decision accordingly.
Yeah, like a perfect summary. So I just want to say that many of the people in the beginning were thinking that, oh, well, we will wait for a Moderna or Pfizer BioNTech because they are 95% efficacious. But there is no point in this. All of these vaccines are almost similar efficacy. 80% today is far better than a 95% efficacy a few weeks, and we don't know when that would be available, and those are expensive also. So the simple approach is that get the vaccine which is becoming available to you, and get it today, tomorrow, not in the future. Don't delay it, and get it for every family member. And all of us who understand or who develop some understanding of vaccines should become a champion of advocating that you people should get vaccinated. There is no other public health measure which is more effective than vaccines. And because like I give this example, so I want to say this, that if you have diabetes and hypertension, you have to take medication every single day, or as prescribed limit, and you have to follow some healthy lifestyle every single day of your life, rest of your life. But when we compare this with vaccines, you take two shots and you are protected for a fairly long period. In some cases, lifelong, like hepatitis B vaccine provide lifelong protection. But even in these vaccines, with the two shots, if you are protected for 1 year, isn't that amazing? It is like very special. Yeah.
As we have read that the National Health Policy of 2017, it has a major focus on NCDs, which is appreciable. But what is your take on it in terms of people who are living with diabetes and UHC?
So one of the key development in last 2 decades has been that the non-communicable diseases have been recognized as a public health challenge or health challenge in the country. Uh, in 2002 National Health Policy, I think the word term non-communicable disease was not even mentioned, or it was mentioned only once, and there was not much of the attention. So one of the key epidemiological and scientific development in the last 15, 17 years is that there is a lot of evidence that NCDs are bigger challenge. We have a better understanding of non-communicable diseases and their burden they put on society and people. The challenge in Indian healthcare system is that it was developed or it was set up 50 years ago, 70 years ago. And that time the health services were health challenges were mainly infectious disease, tuberculosis, other infections which would happen. So the entire Indian healthcare system has been designed for infectious diseases, not for non-communicable diseases. And it takes some years before it can be changed. So though India started the national program for a non-communicable disease, cancer, diabetes, cardiovascular disease, and stroke in 2010, but it was mainly focused on district level, and then there was a plan to take it to primary healthcare center level. But we know enough from multiple other program, mental health care program, tobacco control program, that if a program is on district or sub-district level, it does not benefit people. A health program should be closer to the people. And second part is that this kind of services can be best delivered, and these are the services like for diabetes, hypertension. Because if I need care regularly, I don't want to go and stand in the queue, or I don't want to go far away. So the best approach has to be like the way in UK, general physician or GP type practice. It should be closer to me, and which means it should be delivered through primary healthcare system. Now in India, both rural setting and urban setting, the PHC system is really weak. So my point is that the new national health policy has a lot of attention on non-communicable diseases. It talks about health and wellness centers and strengthening PHC services, but there is a long way to go. I would say that the first thing should be done is setting up community clinic, the mohalla clinic type of clinics, and then ensuring that sufficient medicines are available there. And then people with NCDs or diabetes, hypertension, any NCD who need a regular management can go to the nearby facility and get their blood pressure checked or blood sugar checked, and then get their medication there. And like being in public health and somebody who strongly believe in a stronger government healthcare system, I would say the best healthcare system is one which is attended by by irrespective of the income status of the people. So, best healthcare system would be that no matter what is my, if I'm rich, I should not be thinking that I should be going to a private sector only or public sector. I should be thinking this is the nearest facility and that's where I would go. And public sector facility should be designed that it should attract everyone, not simply poor, or it should not focus on poor only. So primary healthcare system closer to me, if it's well functioning, I would love to go there, get my treatment done, and that's how I will be healthy. That's how what system should intend to do. So to summarize, what has happened in last 20 years that our understanding of NCD and the challenge in India has improved. There is a lot of evidence. There is some policy evidence to policy interventions or policy prescriptions to increase NCD services, but we are still far away from reaching that status where services are available for the people, and that is something need to be done. I strongly believe that for every single diabetic and hypertensive, the medicine should be available at the closest primary healthcare center where person can go and collect his or her medicine for a month. I go again, collect my medicine. That's the kind of system we should develop. And as we discussed in early part of the conversation, that's how these services will become affordable to everyone. And that's how person will be motivated to keep his or her blood sugar or blood pressure under control. And this investment by government in delivering medicines and diagnostic will save a lot of costs in the future, because if those medicines are not available, person's blood sugar remain high, then they develop complication, and then cost of the treating those complications is far higher on the society, on the family, than the cost of delivering the medicines which can keep person healthy, can keep ensure that person is a part of workforce, and it's the objective of the society to keep society healthy. I should not be making 50 argument for that. It's responsibility of the government to deliver healthcare services and keep society healthy. And if government can have a good healthcare system, it's repaid to the society.
Absolutely. I mean, every word that Dr. Lahariya has mentioned, especially now in the last, couple of minutes, I think it really, really rings true for all of us who are living with diabetes, and everyone who's watching this, friends and family members of people living with diabetes. For all of us, I mean, Snehal has been type 1 diabetic for 19 years. I've been type 1 for 26 years. Every single expenditure related to our condition has been out of pocket, and we are middle class people, but what about everyone else? What about the majority of the population in the country? So thank you, doctor, for really highlighting this, and I think this is a great discussion, and hopefully some other time we will also love to discuss this in more depth with you. I'm going to move on to the next question. Actually, I want to let our audience know as well that Dr. Lahariya has written a book which is available on Amazon. The name of the book is Till We Win, India's Fight Against the COVID-19 Pandemic. So for those of you who are interested and would love to understand, I personally am never going to forget the definition of epidemiology or epidemiologist that Dr. Lahariya shared so beautifully. And I think the way that he has explained to us such a complex issue, pandemic or of this level is not just a scientific problem of the virus, but it's also governments, people, rules and regulations, so many things. And he has really summarized this in such an easy way for a lay person like you and me. So I think that I would strongly recommend that everyone please, go on to Amazon and look at Dr. Lahariya's book, and we will put in a link of the book in the description box of this video as well, so you can click on the link and view it directly. So doctor, your thoughts on what do we expect in the book, and how do we could we learn from it for the future?
So Nupurji, thank you very much for kind words about the book. And for audience, I would like to share that I have co-authored this book with two of India's eminent medical doctors and experts. Dr. Randeep Guleria is the director of All India Institute of Medical Science, and he's the face of pandemic response, especially in clinical response to the pandemics. Everybody across the country know he is one of the first AIMS director who is widely known now. And second co-author is Dr. Gagandeep Kang. She's a renowned vaccine expert. She had done research on many vaccines, including rotavirus vaccine. She's the first Indian female to be elected as fellow of Royal Society. So I would say I'm really fortunate to have co-authored this book with them. It comes with some of the distinct features and advantages. And all three of us were very busy from the very beginning of pandemic, but we still decided to write the book. And the reason was that we realized that there is a lot of misinformation going on, which is still going on about the virus and pandemic. In pandemics, misinformation are the real challenge. So we thought that we should empower people with the right kind of information about the various aspects of virus and the disease, and also document the pandemic for future generations. So that's why we wrote the book. We also wrote the book, and that's what readers might find useful, that people are being told that they should do a particular behavior. In my opinion and opinion of we as co-authors, we thought it's not enough. Tell we should tell people that do this behavior, but we should also tell why they are expected to do this behavior. So this book answer why also, why one particular thing should be done. I'm sure when somebody will read the book, they will find it useful because it captures various aspects of pandemic. In the first section, we cover why pandemics happen, and also about the SARS-CoV-2 and COVID-19 disease, including clinical features. It narrates the story that how India responded to the disease or pandemic in the initial 8-9 months. There is a particular section which focuses exclusively on the vaccines, where we have tried to answer the common questions about the vaccines and also therapy. There is a last section where we have explained concepts such as who an epidemiologist is, but more focus on what health system is and what Indian government can do or state government should do to strengthen healthcare system. I specifically kept that section in the book because I personally think that people can be a really important champion to hold government accountable to strengthen healthcare system. If people start asking from the government, demanding from the government to strengthen healthcare system, that's how healthcare system will strengthen. And we provide a useful primer, I would say, to the general public that what health system strengthening is, what government should do and they are doing or not doing, and how people can demand. The last section is how to stay safe, how to prevent yourself from disease and stay safe during the pandemic. We talk about mental, physical, and social health. So I believe people will find the book very useful. It's a detailed book around 350 pages, but it's a low cost book also because that's what we asked them. And what I would say, myself and my co-authors believe in science communication. We are passionate about science communication. So book has been written in a language which general public will like. And the real test would be give the book to a 15-year-old in your family. And I'm sure that he or she would get entire content right. That's the language we have used for general public. So I hope people will enjoy reading the book. And thank you very much for saying kind word, Nupurji and Snehalji.
Thank you,
Wonderful,
Doctor.
Doctor.
Yeah.
Yes. I think I am looking forward to read this book myself, and listening to the entire conversation we had today, I think it will be a really insightful book with a lot of thoughts and all the research and studies that has been done over the course of duration, and to understand it all and in a concise way. I think it's a good opportunity for everyone to learn more.
And I think the difficult part is to explain something simply is more difficult than to just state the scientific fact which might be too complicated for somebody to understand. So I do really recognize and really acknowledge Dr. Lahariya's effort in making us understand, especially about the different kinds of vaccine, and the way he explained the whole thing, the whole last 1.5 year, whatever has been happening, and whatever doubts you've had about which vaccine to take, is it safe, everything is covered in these few minutes that we've been talking to him. And for a deep dive, I would definitely and thank you for keeping the book affordable as well, and keeping it real. And I think this has been one of the most wonderful conversations we've had. So thank you so much for taking out the time, Dr. Lahariya.
Thank you very much for inviting me.